Hello, everybody, and welcome. I am Nisha Arora, immediate past president of the American Academy of Sleep Medicine Foundation. And I'd like to welcome everybody today to Sleep Grand Round, sponsored by the American Academy of Sleep Medicine Foundation. Today, we are very fortunate to have Dr. Candice Alfano join us to discuss the development and implementation of a sleep education program for foster care workers and parents. Just a couple of housekeeping things. I'd like to remind you that your audio is muted and your video is off. We encourage you to include any questions on this topic or for the speaker in the Q&A section of the Zoom platform. This webinar is being recorded, and we will share it with everyone who is registered for the webinar. Additionally, closed caption and live transcript will be available. And finally, the webinar is approved for 0.75 AMA PRA credits. Just to remind everybody, the Sleep Grand Rounds aims to feature AASM Foundation-funded work related to addressing practice gaps in sleep medicine and sleep health. Now, without further delay, I have the pleasure of introducing our speaker today. Dr. Candice Alfano is a professor of psychology now at the Stony Brook State University of New York, Stony Brook, where she recently arrived and will be starting soon. She was at University of Houston for a while, and she's a licensed clinical psychologist and a diplomat in behavioral sleep medicine. She directs the Sleep and Anxiety Center of Houston, or she did, where her research focused on the intersection of sleep and mental health across the lifespan, with an emphasis specifically on trauma-exposed and maltreated children. Dr. Alfano has authored over 150 scientific publications and serves as principal investigator on major research grants funded by the NIH, the National Sleep Foundation, Department of Defense, and NASA. Her work aims to develop evidence-based sleep interventions to improve mental health outcomes. So without further delay, thank you so much, Dr. Alfano, for joining us today, and the floor is yours.
Thank you so much, Nisha. The pleasure is mine. And let's see if I can share some slides here. There we go. I think, does that look good? I hope. All right. Well, thank you so much for having me. I want to say right off the bat that I'm really presenting today on behalf of a team. The work that I'm going to be talking about is very much a team effort between myself and my colleagues, Carol Ripple, Amy Wolfson, and Eleanor McGlinchey. Just some housekeeping slides, no conflicts to disclose. I think our accreditation was already discussed. So let me just go to learning objectives then. These are kind of some broad objectives for today's talk, but my hope is that attendees will be able to recognize the prevalence and severity of sleep problems among this very special population of children in foster care, understand how great the need is for sleep health education and for training for foster parents, and then become familiar with fostering sleep workshops, which is really the culmination of the work that we've done with the funding from a community health grant from AASM. So let me start by introducing you, in case you're not familiar, with Pajama Program, who is really the lead agency for this important project. So founded all the way back in 2001, Pajama Program was started by Genevieve Pittoro, and it started as a very small initiative to provide children in foster care, who in many cases didn't have even pajamas, with pajamas to help them sleep better at night. Since that time, Pajama Program has grown. It is now a national 501 nonprofit organization based in New York City with the broad mission of promoting and supporting a comforting bedtime and healthy sleep for all children so that they can thrive. What I'm going to be talking about today is a joint effort between myself, some other academic colleagues, but really led by Pajama Program and the incredible work that they do. Pajama Program's work and programs are informed in part by a Goodnight Advisory Council. And this is kind of a group of experts in various areas of health and science, including psychology, psychiatry, public health, social work, and other disciplines that work with Pajama Program to inform the programming that they provide. The Goodnight Advisory Council has several members, but myself, Dr. Ellie McGlinchey, and Dr. Amy Wolfson are members of the Advisory Council. And we had been on the Advisory Council when we all kind of discovered that we had this passion specifically for understanding and improving the sleep health of children in foster care. So it was really very fortunate that we all kind of found each other through our shared interests. Okay, with that background, let me just talk a little bit about the population of interest. So nearly 500,000 children in the US are placed in foster care each year. This is a very vulnerable population, as you might imagine, because the health disparities that we see among these children are really more pervasive and significant than almost any other population of children. Just to give you a sense of what that looks like, 50 to 80% of these children have emotional and behavioral problems, up to 75% have at least one medical problem, and more than half exhibit developmental delays. Paradoxically, however, when you look at the research on child health in general, mental health, and certainly sleep health, what you see is that this is a largely neglected population. And there are good reasons for this. Of course, they are wards of the state, these children, and so they're considered a protected population, meaning that, it's not very easy to do research with these children. And that means that our ability to develop and implement interventions that are evidence-based is much more limited, and the process is much slower. When our team started working together back in 2019, there was very, very little information available about the sleep health of these children. Though there was some kind of anecdotal data and some small findings indicating that this was a major area of need. For example, there was a study suggesting that foster care agency staff identified sleep as critically important for these children, but also an area of health and wellness that was generally neglected. There were a few retrospective studies of adults who had formerly been placed in foster care, and what they showed was that the sleep problems in this population are pervasive and that they persist well after a foster care placement ends. So even after children were adopted and even into adulthood, when they were independent adults, these individuals were still suffering from severe sleep problems. And then there was some other kind of anecdotal data suggesting that when these children had sleep problems, things just were worse across the board. So they spent more time in foster care. They had more placement breakdowns, meaning they got moved around more in foster care. And that, by the way, is really significant because if you look at the literature, the number one predictor really of outcomes of children in foster care depends on how many placements they've had, how many times they've changed homes. And if children with sleep problems also, as you would expect, had many more emotional and behavioral problems. There was also one study published now 15 years ago, but it really, at the time, was the only study that compared the sleep health of children in foster care to a matched sample of community control children between the ages of 3 and 7. And what was particularly unique was that they used actigraphy to assess sleep. So you're all familiar with actigraphy if you're wearing an Apple Watch or a Fitbit. Basically, what that is an accelerometer that measures movement. But an actigraph is specifically designed to translate that movement into differentiating sleep from wake periods. And so it's considered an objective measure of sleep. So children in this study wore actigraphs for 5 nights, and the goal was really to see whether children who or how much children slept at night, how much children sleep at night predicted next day behavioral problems. And what you can see from the graph here, unsurprisingly, based on the slope of these two lines, is that for all children, less sleep, which is down here, meant more problems with inattentive and hyperactivity behavior the next day. But what you can also see is there's a tremendous difference based on the same amount of sleep with the number or the degree of problems that we see in our foster care group. Um, but what the study also showed, and what I think it was pretty cool, was that when children in this age range, 3 to 7, were getting closer to the amount of sleep they needed each night. So we moved down here to, around 11 hours, which is what you would hope this age group would be getting. What you see is that that risk ratio drops dramatically from 5 times greater inattentive and behavioral problems to 0.5. Again, we're still seeing more next day behavioral problems in these children, which is not surprising because they have more problems to begin with. But it really gives you a sense of the sensitivity of these children to inadequate sleep. And so, for a population that already struggles with emotional and behavioral regulation, it really emphasizes how important a good night's sleep is for these children to function well during the day. And so the results are not surprising from the standpoint of we've had decades of research that tells us that sleep is critically important for emotion regulation, behavior regulation. And this is true for us adults as well. When we don't sleep well, we probably are not as patient the next day. But it's particularly true for children who need much more sleep than adults. Um, but the other thing that's really noteworthy and really aligns with what we know is that early maltreatment and trauma produce sleep disturbances regularly. In fact, sleep disturbance is one of the most frequent and enduring consequences of these early childhood experiences. Um, the reason for this is multifold, but one reason is that when we encounter stress and trauma, our body stress response systems kind of go into this persistent activation mode, almost like we're prepared for more struggle or more trauma. The problem is that this increased arousal doesn't necessarily attenuate at night. That still children stay aroused, they stay anxious, they stay hypervigilant, and that of course interferes with sleep. But more so than just what the body is doing internally, other experiences that these children have also, we know, put them at risk for sleep disruption. Things like inconsistent caregiving, attachment disruptions, housing instability, homelessness, domestic violence, whole host of stressors that fall into the umbrella of interpersonal violence or abuse. And then, so what we know over time is that this creates a very vicious cycle for these children, whereby poor sleep reduces capacity to regulate emotions and behaviors during the day. This, of course, increases arousal and anxiety both during the day and at night, that in turn preclude restful sleep. And so the cycle just kind of goes on and on for these children on a regular basis. So, in 2019, Carol Ripple, who is the former chief program officer at Pajama Program, now a consultant at Pajama Program, myself, Dr. Amy Wolfson at Loyola University of Maryland, and Dr. Eleanor McGlinchey at Fairleigh Dickinson University, decided that we needed to know more about the sleep health and needs in this population. And so we worked together to originally design a focus group study where we were planning to bring in foster care parents, but also foster agency staff, so that we could learn more about the sleep-related challenges and needs of these children. And then COVID-19 hit. And much like every other researcher, we had to quickly pivot and figure out, how we could still conduct this work. So ultimately, we used an online survey format for data collection, which we weren't sure how that was going to turn out at the time, but ultimately we were very, very happy with the results, because we really were able to acquire a very rich data set. So we conducted a national survey, and we were able to recruit almost 500 foster caregivers representing almost every state. And we asked them to tell us about the sleep of one child currently in their care between the ages of 4 and 11 years. Um, Certainly, sleep is an issue from birth all the way into adolescence, but we wanted to kind of focus on the age range where most of children in foster care fall. And so we learned a couple of things that were really quite startling. First, we asked foster caregivers to tell us, what types of sleep problems does your child experience? And the rates, honestly, were really staggering. So 86% of our sample said that their child sometime or always tries to move to someone else's bed during the night. More than half seek out or require a caregiver during the night or at the beginning of the night. 51% had regular nightmares. 34% had sleep terrors. Bedwetting was prevalent. Grinding teeth. The list is much longer than this, but I think what I really want to convey is that these are numbers that you don't even see in psychiatric populations. These are really pervasive and very prevalent problems in this population that I don't think we were even prepared for. The other thing we asked them was, well, what do you do to support these children around sleep? 55% of our sample said that they had spoken with a healthcare provider about their child's sleep. To put that number in context, if you take a community sample of parents and you ask them, how often or do you talk with your pediatrician or healthcare professional about your child's sleep, the number comes in at about 4% or 5% of parents. But in this case, we've got more than half reaching out saying, I need help. Um, what I also will tell you is that unfortunately, most of these parents were given either the recommendation to give children melatonin or some over-the-counter medication, or they were prescribed medications. That's really important because there are no FDA-approved medications for sleep in children, and there are no safety or efficacy data regarding the use of melatonin in children with a history of trauma. What parents weren't receiving from healthcare professionals or what's considered the gold standard intervention, and that's a behavioral intervention for sleep problems. We also asked our parents if they received information, education, or support from the foster care agency they work with. And only 12% said that they had received any information about sleep. And all of these parents indicated that this was just in the form of an informal discussion because they had asked their case manager a question or brought up a problem. So, really, they're not getting any systematic information about sleep. Um, that last bullet is really especially surprising because all states, to some extent, require that prospective foster parents complete trauma-informed training to become a licensed foster parent. It differs dramatically across states. I think in New York, it's about 30 hours that foster parents have to complete. And typically, these trainings include a focus on state guidelines and regulations, so what foster parents are allowed to do and not do, how trauma affects child development, and the typical behavior problems that you see in these kids and some basic strategies for managing them. Notably, however, no foster caregiver in our survey mentioned receiving any information, training, or supervision around sleep problems, despite the pervasiveness of these issues. So that leads us to the aims of the current project, that I won't kind of read here or belabor, but our community sleep health grant funded by the AASM sought broadly to understand the problems and the needs in this population, and then to take that information and to develop an accessible training for foster caregiver staff, and parents to help them deal with the problems that they face at home, in some cases on a nightly basis. So we recruited 36 foster care caseworkers and managers in the states where our team were located: New York, New Jersey, Maryland, and Texas. And the only requirement was really that they have some kind of a direct interaction with these families. We use semi-structured interviews because they really are ideal for this type of work. They give open-ended opportunities for participants to respond to questions. They're more flexible. And our interviews were guided by the Consolidated Framework for Implementation Research. The link is there if anybody's interested. But broadly, we wanted to know what was the existing knowledge base about sleep, what resources are currently available for families. We wanted to provide education, or we wanted to understand how families understood the impact of adversity trauma on sleep, and look at barriers and supports for the work that we were doing. Just briefly, we coded the interviews after the fact by two trained raters. We use something called inductive thematic analysis, where the data are first coded into themes, and then within those themes into specific codes. And so this is kind of an iterative process that our team went through and ultimately kind of verified. So among our 36 participants, as you might guess, 35 of them were female, which is very common for this workforce. We had case managers, clinicians who worked within the agencies, outreach staff, adoption managers, so people in different roles, but all of which had direct contact with families on a regular basis. I don't want to spend too much time on the interviews, but these were the coding schemes that we came up with. There were 6 kind of themes in total, and then from there we broke that down into codes within each theme. And this is how we kind of coded the data. And we described in a paper that was published just this year in the journal Child Welfare. That QR code right there will take you directly to a PDF of the article if you're interested. And I'm also happy to send that to folks. And I won't spend too much time going over all the details of our qualitative interviews. I did want to just share with you a couple of the quotes that came out that really inform the work, and to give you a sense of the challenges these families are experiencing. So one caseworker told us maybe 40 to 50% of kiddos that have experienced abuse is around sleep or bedtime. So it's just that fear of what's going to happen. Sleep is definitely one of the biggest issues. If the kids aren't getting enough sleep, foster parents aren't getting enough sleep, and then the whole family is in trouble. Kids can take like an hour and a half or 2-hour naps during the day, and then that's enough for them to be up all night. And some kids keep themselves up on purpose. Those are the kids who've probably been taken from their sleep, from their parents in the middle of the night, and they're afraid to go to sleep. So that just gives you a sense of the questions that staff are getting, but also the challenges that parents are facing. So from this information, I think the more exciting part, we developed fostering sleep workshops. This is a 90-minute workshop provided to foster care agency staff and or parents, and it provides trauma-informed, evidence-based information about healthy sleep, and then actionable strategies for parents or for staff to help these families. Um, and because the staff are the ones who are kind of on the front line, so to speak, they're the first ones to get the call in the middle of the night, when things are really kind of going off the rails. So we really wanted to make sure the information was not only reaching families, but also reaching staff, because they're kind of that ongoing support. Um, our presentation, the workshop, includes a number of slides that are interactive. They include polling, so the audience gets asked questions. There's some time for discussion. But basically, we cover kind of the essential role of sleep. We very quickly get to strategies that can be shared. And as I mentioned, we really like for staff and for parents to learn from each other. So we try to incorporate discussion as well. The education we provide really starts with how essential healthy sleep is for every aspect of child well-being. And this is it's watered down to make it very easily digestible, but it's really based on decades and decades of research showing these relationships to be very, very potent. We talk about the role of trauma and how that impacts sleep in various ways. Those quotes that I showed give you a sense of how it can show up differently in different children, but it's all kind of rooted in early trauma. And then we kind of go into strategies to support foster parents in using specific things they can do. And a lot of this work is guided by the 4C model of healthy sleep, a model that I developed back in 2023 that takes a lot of really the research that we've done and condenses it down to what really we've determined to be kind of the critical components for these children. These are the 4Cs here. And again, we're short on time today, so I won't spend too much time on it. But calm evening environments is critical for these children to kind of reduce arousal at night. Consistent, adequate schedules, routine is provides an incredible sense of security for these children. Cues that signal sleep. So these are children who've really never, in many cases, learned how to use cues in the environment or things that they can do to help them prepare for sleep. And then close connection. So we really pay attention to the role of the caregiver, understanding that that's how children learn to sleep early in life. But many of these children have missed out on those opportunities. And so we really make sure to teach caregivers how to be involved in bedtime routines, to focus solely on the child, to help them feel calmer at night. This is a QR code to the paper that was published based on the 4C model. And again, I'm happy to send that to folks as well. In addition to the presentation, families get a handout, so they get a healthy sleep fact sheet. We don't expect them to remember everything in a 90-minute workshop, but this is something they can take home and use. And we also provide a healthy sleep checklist, both a version for foster care agency staff as well as foster parents. These are things to think about for each individual child in terms of how it may affect sleep, and then how it can inform different interventions within the home. The good news is that to date, Pajama Program has delivered the Fostering Sleep Workshop to 101 foster care agency staff. And that, of course, then trickles down and affects over 1,800 foster parents and over 1,800 foster children. We've also done some post-workshop surveys, and what we find is that both parents and staff are incredibly appreciative and in agreement that these strategies are helpful, that they're things they can use right away, and that they would recommend the workshop to other parents. So, in summary, this is a population with a tremendous need for sleep health education and intervention because these problems are not limited to their time in foster care. Learning to sleep is a lifelong skill. And so, unsurprisingly, for these children who are placed in foster care, these problems persist over time in many cases, and then they go on to elevate risk, of course, in other domains. Sleep-based education and support are surprisingly lacking for foster caregivers, despite the fact that they receive training in so many other things. Our 90-minute educational workshop, which was developed for and provided to agency and staff, really is filling a major gap in care at this point, in part because it not only provides education, but it provides strategies, which is what parents need in the middle of the night. And our implementation so far suggests that these workshops are really well received. We don't intend to stop doing this work because there's a lot more to do, including expanding delivery of the workshop to agencies in other states. The nice thing is it can be delivered in person or virtually. We've done both, and both are very well received. But we're also very interested in thinking about not necessarily having this as a separate workshop, but how do we get this integrated into the standard training that is mandatory for foster parents in different states? Um, and then the last thing I'll say is our team also worked on a paper that was just accepted for publication, where we reviewed regulations and guidelines in all 50 US states, looking at how sleep is discussed in terms of what does the environment have to include? What are parents allowed and not allowed to do? Um, Spoiler alert is that there's no consistency across states, and really the guidelines are more around the physical environment. There's very little around helping children feel safe and behavioral strategies. So our hope is to ultimately take this work and try to inform um, the legislature and policymakers on how we can integrate this information that we're collecting into state guidelines so it reaches these children on a more regular basis. I want to say a tremendous thank you to AASMF. This work would not have been possible without their support. And they have really kickstarted or helped to kickstart, all of these initiatives that our group is pursuing. We've had many partners in these endeavors, too many to thank. Some are listed here. But thank you for your time, and I'm happy to take any questions.
Okay, thank you so much for that absolutely informative and such important work, Dr. Alfano. I don't see any questions yet on the Q&A. So while we're waiting for those, I have a couple of questions and thoughts. So my question is there a way for within these workshops or whatever platforms you have available to kind of share information about sleep and securing the sleep environment for the child? Is there any thought about how to make consistent across various homes or situations that the child may be, the displacement issue, transferring that information from the previous set of foster parents or home to the next set? Is there communication, or is that even a thing?
I love that you brought that up because that is one of our chief recommendations in the paper that I mentioned that was just accepted for publication, which is that at the very least, we should be documenting in these children's records, what do they like to sleep with? What is their sleep history? So that, not only can foster parents know what was happening in the previous home, but what was happening before they came into foster care that informs some of their sleep problems. To answer your question, no, there's nothing systematic currently. It was really surprising for us in doing this work how little attention is paid to sleep. And yet it would take so little in many cases, something like documenting it in a child's record, that they have a special bear they always have to sleep with, or they need to sleep with the lights on. That would help children transition um, so much potentially more easily, but currently is not even really something that's being discussed.
Yeah, that does seem surprising. Um, I guess the second part of that was as they're, kind of being shuffled from different homes, etc. I imagine they're in some kind of group home or facility between placement opportunities.
Not necessarily. It's and this is part of the challenge is that they come in with such unique experiences. Usually the kids who go into residential facilities, I'm sorry to say, are the kids with the worst problems, because foster placements have broken down and, more than one foster caregiver has said, I can't handle this child for whatever reason. Although sometimes there's just not enough foster parents, and this is something we're facing really nationally, certain states more than others, but there is just a lack of good licensed foster homes. So there are some instances where kids who don't necessarily have behavior problems do go into group homes. We've talked with and worked with group homes a little bit in terms of how they can kind of implement a environment that's conducive to sleep. Every institution is different, and so it's hard to kind of make across the board recommendations. But that's another area of tremendous need are these group or residential homes where sometimes lights get thrown on early in the morning, there's a lot of noise, schedules are not necessarily consistent, things like that.
Yeah, that's very challenging. Um, so I do have a question for you from the Q&A platform. Do you have any information on children who experienced homelessness and feel more comfortable in environments that are not so safe and comfortable? So these are asking about children who are homeless, um, and I guess how to make them feel more comfortable in environments that are not so safe and
Yeah.
comfortable. It's the way I'm interpreting this question.
Yeah, I'm trying to think about the many ways to interpret it too. Many of the children in foster care have experienced homelessness at some point. Homelessness looks different, right, in different families. Sometimes it literally means living on the street. Sometimes it means crashing at family members. Sometimes it means living in a shelter. So even homelessness is not, one thing. We are actually with Pajama Program, we are currently very much interested in working with some family shelters in the New York City area to try to help them to assist families, both parents and children, in these settings get better sleep.
Yeah. And I
For,
got some more clarification on it
oh,
too.
okay.
Also, the question is that these children have been homeless and feel like sleeping outside or in a car is actually better.
So anecdotally, we've seen things like that. We've seen children who want to sleep in the closet. We've seen these are major challenges. And of course, depending on the age of the child, you can potentially talk with them and try to get a sense of what is it that we could do in your bedroom to make it feel more like that or to make you feel safer. It's harder, of course, when these are younger children who are nonverbal, because you don't have that benefit. But those are the cases that take a lot of kind of upfront support. So in addition to the workshop and the training, separately, I've developed a sleep intervention for these children that kind of builds on all of the education they would get in a workshop. And it's more, let's work with this individual family to figure out what we can do to support this child, because they're experiencing a major change in their sleep environment. And of course, our sleep environment provides tremendous cues for sleep at night. It's why we don't sleep as well in a hotel or at a friend's house. But those are kind of individual cases, and they can be extremely challenging.
Well, I bet that certainly sounds very challenging. Another question that's just coming to my mind is, when do you or when's good to kind of advise about melatonin? Like what other specific situations
Yeah.
where that can really help facilitate the child's sleep when you know something's going to be especially difficult? And can you comment
Yeah.
on that? I don't know if that's a fair question for you.
Yeah, well, it's an important question because the percentage of children in our sample who were taking melatonin was over 50%. So this is a go-to for, healthcare professionals to recommend, but also, I mean, in the United States, unlike most other countries, you can get it over the counter. The problem with that means that it's poorly regulated. And there have been numerous studies showing that what's indicated on the bottle is not necessarily what's inside. This makes research very hard. It makes recommendations for parents very hard. What I'll say about melatonin is that we have a number of randomized control trials showing us that melatonin is helpful for sleep in many children with autism and children with ADHD, and that it's relatively safe. What we don't have are any controlled data in children with a trauma history, including maltreatment. And the reason that's meaningful is because one of the things that melatonin does is it increases REM sleep, rapid eye movement sleep, which is where we do our dreaming or most of our dreaming. And we've had anecdotal reports from foster parents saying, I tried to give my child melatonin, but they woke up screaming with horrible nightmares. So it's really a very individual issue. If melatonin works for your child, and there's no kind of side effects, it's probably okay. The problem though is that what we find in our foster parents is that they're giving melatonin for sleep problems for which melatonin's not indicated. Melatonin helps children fall asleep, and there's some indication that it helps them stay asleep, but mainly it helps them fall asleep. Um, in our study that we did, what we found was that foster parents are giving children melatonin for nightmares, things like sleep terrors, bedwetting, things that it's not indicated for. And so in those cases, there's really no point in giving the child melatonin. What we say to caregivers is sleep is a behavior. You have to learn how to do it. And these children have either never learned or they've forgotten how to do it. And the problem with giving them a pill, even if it's relatively safe, is that it's not teaching them anything. It's what it potentially is teaching them is that I have to take a pill in order to sleep. And in a recent study that we haven't published yet that we did, what we found was that compared to community control children, children in foster care given melatonin were much more likely to believe that they needed that pill in order to ever be able to sleep. And that's what we don't want to see, because that's how insomnia kind of takes hold and is perpetuated over time. So melatonin is not necessarily a bad thing, but it's not a panacea. It's not for every sleep problem, and it also doesn't work for every child.
Hmm. Excellent points. Thank you, Dr. Alfano. Just kind of thinking out loud, even the impact of the child's sleep on the foster parents' sleep and their likelihood of caring or volunteering to care if their own sleep is impacted. Just so many things come to mind.
Yeah,
Uh,
yeah, that's something that we've been assessing too in our work is, how is it affecting your sleep? Because anybody who's a parent who's listening knows that when you haven't slept well, you are not doing your best parenting by any means. And so
Correct.
these kids, that's so very important.
Yeah. Well, I would like to thank you, Dr. Alfano. This was absolutely wonderful, and I want to thank everyone that participated today. For today's webinar, there will be an email sent out with instructions on credit claiming. And this, like I said previously, this webinar is approved for 0.75 credits. And just to give you some additional information, the AASM Foundation has additional webinars taking place this week. I'm really excited, and we invite you to register for our strategic research grant webinar in August to learn more about this grant program, which is really one of the pillars of our programs. And for also register for our webinar in community collaboration in research, which is taking place in September. And registration for both these webinars is now open. Additionally, and very excitingly, the foundation, AASM Foundation, is again partnering with the Sleep Research Society Foundation to support its small research grant program. So applications for that are now being accepted. So lots and lots of great things happening and opportunities with the AASM Foundation. So with that, I want to thank everybody for being here, and thank you, Dr. Alfano, again for outstanding presentation. And have a wonderful, wonderful week, everybody, and we hope to see you at all our next webinars. Take care and thank you. Bye-bye.
Thank you, everyone.